Flu activity nationwide may have decreased a bit this week, according to the latest report from the CDC, but it's still higher than it should be.
Yeah, so Crystal is here with a look at what's going around. Ready for this flu season to end, Crystal?
Oh, so am I. So flu and more flu. That's what doctors and nurses continue to see over and over again in their offices. This week, doctors in St. Johns County at the Care Spot say they've been taking extra measures to help stop the spread of flu. They're passing out face masks like this one right here to guard against influenza. And if you have the flu, you're coughing and you're sneezing and still going to work, you get a mask. So flu A and B, that's been hitting them the hardest. And the clinic actually says that they had to order more flu kits this week because they've gone through their entire supply. And it's something that they didn't experience this time last year. So nurses say a lot of their patients have tested positive for the flu, even though they've already had their flu shots. And unfortunately, that trend continues in Duval County. Doctors with the Care Spot on the south side say that flu has been the main problem, and a handful of their patients with the flu vaccines are still getting the virus. In Clay County at the Care Spot in Middleburg, their office is treating up to 50 to 60 patients a day with influenza. Wait times for walk-in patients have been significantly longer, with people sitting in the waiting rooms for up to 2 to 3 hours. Strep throat, upper respiratory infections also reported this week. And in Nassau County at the Care Spot in Yulee, a third of their patients who have been walking into their clinics have tested positive for the flu. Their wait times have been 45 to an hour long, which is, again, longer than usual. And pollen and allergies have also led to a number of upper respiratory infections. So you really got to be careful out there. Make sure you've got your proper hygiene and you're staying home if you are sick. Now, switching gears just a little bit, have you noticed that more people at work are turning their workspace into a standing desk at work? Well, after hearing claims that sitting is the new smoking, some of you may be thinking about switching as well. So why not? In the past 15 years, sitting has also been linked to a host of health problems such as diabetes. But we want to look, is there really more to it than that?
Yeah, it's just sort of a
Sitting may be getting a bad rep. A recent study published in the British Journal of Sports Medicine took a look at nearly 5,000 public servants in the United Kingdom. The subjects were on average in their mid-40s with no history of diabetes, heart, or circulatory problems. Most claimed to be physically active, but over the course of 13 years, only 402 of the nearly 5,000 workers developed diabetes. The report concluded that the fix for sedentary lifestyles may be more complicated than just eliminating as much sitting as possible. Researchers say more attention needs to be paid to the type of sitting and the context around it. For example, higher status jobs are usually associated with sitting, but those in higher socioeconomic positions are shown to have a lower risk of chronic diseases. Meanwhile, which involves a lot of sitting, has been linked to issues like unemployment or poor mental health.
So the study's authors say before deciding that sitting is a risk to your health, you should look at how much exercise you're getting to offset your sedentary spells. A recent review also found that 60 to 75 minutes of physical activity a week eliminated the increased risk of death associated with sitting.